format is Jim's going to present for about 15 minutes. I'll present for about 15 minutes, and then we'll have some Q&A. Try to keep it short and sweet so we can respect your time. If you have questions during, please use the chat option. We will answer any questions, and appreciate your time today joining us. So with that, I am going to share the controls with Jim.
All right, very good. I think I've got it. Good morning. Nice to have everybody here virtually. I thought we'd just kind of dive into it here. And mouse feature, there we go. So 2020 is kind of starting off with a bang. We had a price war and still have one in the oil industry, which is slashing production in the US. The stock market's depleted off about 30% of its value from time to time. The coronavirus pandemic is there. And of course, the big story of the year, Tom Brady has left the New England Patriots. So a lot of things going on, a lot of moving targets, a lot of things that are floating about. Employer responsibilities throughout the coronavirus situation. The main one is to keep the office work environment safe. That is a responsibility that all employers will have, always have had. Number one, keep your sick workers out. You can make material available for them, and you should, for their workspaces, washes, wipes, etc. Set up parameters for those who can be in the office as to when and where. Many people are bringing employees in on a select basis. They're also bringing them in on a very minimal basis. Interestingly enough, it appears that about 80% of all employers appear to be essential in some way or another, or at least consider themselves so. At the same time, a lot of those employers are still letting their employees work from home and have very minimal staffs internally. Essential businesses and workers, as well as visitors and business travel. Obviously, business travel is diminished substantially. And very few people are doing any type of face-to-face work. It's always appropriate to ask the employees to report an illness to HR or that person who takes those responsibilities. To ask that person that is not a HIPAA violation, so don't worry about that. The objective is to keep the workplace clean and safe. So how about that work at home thing? It sounds good, but there are some issues. And the main one, of course, is reduced productivity in many cases. The ability to track the work that's being done, to make sure that goals are being accomplished, that processes are being followed, it's difficult. And then we have the emotional impact. And I'm not sure about everybody else out there, but we are certainly seeing amongst our clients and our own staff that the emotional impact of having to work at home under unique circumstances is certainly taken a little bit more of a toll, I think, emotionally in the last 10 days that it had in the first 3 weeks. The first 3 weeks was kind of a novelty, kind of interesting. Let's see how it goes. I think people are kind of getting sick of it, but it could be the way of the future for a while. Secure technology is first and foremost when this is happening, and Eric's going to be speaking a lot to that here later. Shelter in place. These violations are personal. They are not a business liability necessarily if they're announced properly. But I would let you know that they are happening in Oklahoma. People are being cited. We have a client who did get an employee was cited for not being considered an essential business, and the employee was out, and they got a ticket in Yukon, Oklahoma. So it's out there. There are two major pieces of legislation that got passed. We'll review these briefly. The first one is Families First Coronavirus Response Act. These regulations began April 1st, and they will go through December 31st of 2020. It's important to realize that many of these legislative pieces and regulatory pieces that are out there typically have two deadlines. One is December 31st of 2020, and the other one is a subjective one that will be when the declaration of emergency is removed. So whenever we hear the president say we are no longer in a state of emergency, there are certain smaller provisions that will be taken off the table at that point. The law provides free coronavirus testing until the emergency declaration ends. It also provides unemployment assistance at a couple different levels. One of the interesting things is this is one of the first laws that I'm ever familiar with where if childcare was unavailable, benefits were going to be payable to employees. This is an add-on to the FMLA benefits that are already out there, but you do not have to have more than 50 people for this portion of the FMLA to be met. And that is if you have a qualifying need because of a child's daycare. There is also a safety net for some of these provisions for company viability, meaning if we still need to let go of these people because we aren't getting any revenue, are we going to be protected from the Response Act? Oops, can we go back there, Eric? I'm not sure why it's jumping there. But we want to make sure that people know that, you know, if you've got to make a business decision for your business just to stay alive, that's perfectly adequate, but it should be well documented because it could be an issue. There are also several other exceptions and caveats. It's a very complicated law, thousands of pages of regulations, as you might expect. So we have some handouts on that that are available that we can make available to you. If you have detailed questions on that later, please let me know. Some of the other things in the Family First is the fact that all these payments are basically going to be funded by tax credits on Form 941 and other payroll taxes. By reducing your payroll tax deposits, you have money to put back into the business, pay salaries, et cetera, et cetera. And all these program responses for the Families First provision are effective if the employee is diagnosed with COVID-19, if they are caring for a family member that has COVID-19, if childcare is closed due to COVID-19, and oops, let's see, can I go back there? A couple more things here, I think. Nope. So those are the main things there. This is a diagram that we can send you if you like that just sort of outlines how it works. You basically have 10 days of paid emergency leave up here, count them, 10 days. And this gives the examples of how people can qualify for that. There are certain situations where you can have an additional 12 weeks of benefits where your salary can be paid at 2/3 its pre-leave level. Also, just like anything else with FMLA, the job protection must be in place. So very similar to FMLA if you have a larger company. If you have a smaller company, the job protection aspects of it are still in place unless it meets the sustainability requirements for your company. A lot of detail in that area, something more we can get into in detail, but it would take longer than what we're planning on doing today. As far as health plan issues, there's really a vast change in how things are working now. For example, April 1st was basically an open enrollment for everybody. High deductible plans will cover COVID-19 expenses on a first dollar basis. Plan design changes may or not be made mid-plan year. So if you wanted to take your medical plan and say you were trying to cut costs, you could go from, say, $1,000 deductible to a $2,000 deductible to save premium. And the carrier would have to make those changes for you mid-year. And all the major carriers have agreed to do this. So that's working out really pretty well for the most part. Participants can also add and remove coverage mid-year, even if they're on a flexible spending account, which typically did not allow for mid-year changes. Employees who might be furloughed, who might be having a reduction in salary, can now make changes by either declining or adding both themselves and their dependents to the medical plan. Certain aspects apply to the medical plans, but not necessarily to other plans, i.e. your life insurance plan, that may not be able to change. Your dental plan, that may not be able to change. Many dental carriers are allowing the same types of changes for their coverage as for medical coverages, but that's not across the board. So you need to check with your plan and check with your carrier. FSA elections can be made to change dependent care mid-year. Obviously, if your dependent care situation is closed because of the virus, there's no need to make payments. But check with your carriers regarding furloughs and layoffs. Furlough, we are seeing a lot of that. They are letting employees off the payroll, but most of our employers are actually continuing their benefits, hoping to bring those employees back within 90 days. We'll see how that goes. With a layoff, typically a layoff is involving a direct termination. So there is no promise or even indication that the employee will be able to come back. Some employers are continuing their benefits for a month or so, while others are just terminating immediately, and the employee must go through the COBRA process if that plan is eligible. If you are doing something with a furloughed employee, as far as the employee's contribution, please be sure that you have some type of a plan in place to get that employee's contribution for their medical plan, unless you're agreeing to pay for it at 100% all on your own. And we just want to make sure employees and employers have a good understanding of who's going to pay for what if you are continuing the benefits for them. If there is any other information you need, we have a website set up that is available to the public without any type of requirement or sign in, etc. And it's aleragroup.com/coronavirus. Plethora of information out here on all the legislation, the regulations, and it is literally being updated hourly. So absolutely wonderful information, well organized. You should be able to find anything you need. And if you don't, please feel free to give me a call or an email, and we'd be happy to get that information to you. So Eric, I'll turn it over to you on the IT side.
Great, thanks, Jim. I want to actually mimic something and praise Jim's group. Alera has been one of the best resources for information that our company has had. Their newsletters, their emails that they've been sending have been basically on point. And right now we're all getting inundated with so much information that it's hard to kind of disseminate through a lot of it. So I will definitely praise them, because they've been one of the first resources our team's gone to confirm and look at this information. So the fun part of everybody's working from home now. So we saw a mass of requests at once where everybody is trying to take 70, 80, sometimes 90% of their workforce and have them work remotely from home. This is a key piece because we want to make sure it's secure, convenient, and as stress-free as possible. But for the company's sake, we got to make sure that we're controlling data, productivity, and communication. So with data, some of the things that we've talked about with a lot of our clients is, do you actually have a remote work policy? If you're unfamiliar with an environment for working on company data, they'll take this for granted. And it's one of those guidelines that I'll use the example of, if you've got a dedicated PC that somebody's working on home, you know, don't do your Facebook browsing and so forth. Keep it dedicated for work. One of the best things is to remind everybody that the policies that you have in place that are still applicable. So, you know, no harassment, bullying, cybersecurity, they'll all still be expected to follow those regardless if they're home or not. The files you copy to your personal computer can represent a breach in confidentiality or policy. So if you're in healthcare or you have regulatory, there are obligations on what you do with certain data. So your staff needs to be aware of not copying it off of a corporate device or network onto a personal machine that does not have the same standards in place. They also need to understand how to access it correctly, where they're saving it, to avoid any problems down the road. Simple thought here is, I'm not backing up every employee's personal home computer by default when this transition took place. If you do have a key machine that wasn't a key machine before, we may need to add backup to it. So that's critical for where people are saving it, and they need to be aware of that versus just default hitting save and not knowing where it's going. Check with your IT department, make sure, ask the questions, because in our world, and for most businesses, the system can go down, but the data is what is important. So some security. The best piece of advice is sometimes some of the simplest advice. Whether they're on a home machine or on a corporate machine, the updates need to be installed, especially if they're working from a home machine, because people don't always have the right systems in place to make sure that they're automatically updated what's being done. We find a lot of people that we're talking to either haven't updated the antivirus, that they don't have, this is a scary part, may not have antivirus, or they had antivirus on their personal machine that when they bought it had a year free and they didn't renew it. So checking these things are critical. I suggest removing unnecessary software. So if you've got, Windows 10, you don't need the poker game or anything else on that machine. Just limit the risk is what we've got to start looking at. I always suggest using a virtual private network, VPN, at all times. Your company may have one specific to accessing the corporate network. That's great, but if not, there are providers like NordVPN, CyberGhost, and IPVanish that are considered pretty reliable. Most of you have probably heard me speak before. Nobody can ever guarantee 100% security, but having these steps in place are critical to making sure that you're going to continue to work. And I'm going to highlight more security. At home, turn off the automatic connections to your Wi-Fi. This is a very easy way for hackers to gain access to your computer by spoofing your Wi-Fi. Another simple piece, when you're away from your computer, make sure it's locked. We don't want your kids to accidentally delete something important. I've got a 2- and 3-year-old. It can happen pretty easily. Definitely don't be click happy. There has been a massive amount of cyber attacks related to COVID-19. I specifically say don't ever click on any map if you didn't go to that website specifically, and only go to known trusted sources for the type of information, the CDC. If you want to go to certain news, go directly there. If it's sent to you, don't click on it. Another suggestion is use Mozilla Firefox or Google Chrome as your internet browser. They are the most up-to-date and secure. And then security awareness training for your team. It's absolutely critical right now. Like Jim said earlier, there's a lot of feelings and emotions, and a lot of people, it's fear right now. So when they're at home, a lot more people are trying to intake information. And we need to make sure that they're armed with what information that they need to avoid. There are IRS scams about the stimulus checks. There's all sorts of things. And most of these play on the human emotion. So we've got to at least make people aware not to let it get them worried enough that they go, I got to click on this to find out more. I say this in multiple ways, and it's very true now. People are the last line of defense. Nobody in IT can force an individual not to click on a link or a Facebook post that's malicious. Over 91% of these breaches start with spear phishing. So if you're in a C-level position or above in an organization, you need to be aware of this, because you've probably got a LinkedIn profile. You may be on the website. These hackers are going out there and getting information about you. I love something that I saw on Facebook that said, don't be bored right now and answer the questions of, here's the high school I went to, here's what my first car was. If you really start to think about that, some of these are security questions banks, credit cards, vendors ask for So if you're publicly posting it out there, you're almost giving hackers the information they need to try to access your information. And hackers know that most people are working from home right now. They're not behind corporate firewalls. So they are actively seeking to exploit this and to steal company assets. I follow a lot of different information. These hacker groups promised at the beginning of this that they were not going to attack hospital networks. Well, 2 weeks in, surprise, surprise, they did. I mean, you just cannot believe, and I hate to say that there are people out there that do this, but we just have to protect everything as much as possible. We will make the presentation information available. A lot of people love this slide because it just says, here's some things to check. If you don't recognize that it's from an individual that you were expecting to get an email from, don't answer it. Don't click on it, just delete it. Pay attention to the actual email address. A lot of people we saw some fake ones from Microsoft where they replaced the O with a 0. So you really have to pay very close attention to that little detail. I tell people right now, or always, nobody's going to email you out the blue and say, your uncle in Africa left you $1 million. Well, if you didn't know about it, it's not true. So the best piece of advice is slow down a little bit. Pay attention and look at it. You can hover over hyperlinks to see if they're actually going to the place that they're implying. So be very cautious. Productivity. Collaboration right now. If you use Office 365, you already have access to Teams. It is an instant messaging application. We do video conferencing through it. You can collaborate on projects and other features. If you don't already have Office 365, Microsoft is offering it free for 6 months right now. Any other video conferencing, WebEx, Zoom, they offer free versions, but be careful of free versions. Usually when it's free, it means less secure. We are currently on Zoom, but they have an updated application. They had a breach even last week. So we are trying to tell people and clients, reset your passwords. As it comes to productivity, nobody likes the word micromanaged and nobody wants to be managed, but everybody understands the need to triage. And we're in an event that's never happened in my lifetime and most people's lifetime. So we understand the triage type mentality. Now more than ever, those systems, the processes and workflows that you've had need to be used as intended. We've got to remind people, just because this is an event, sometimes we've got to slow down and think about it. If you had to have somebody enter time on a daily basis, then it still needs to be done on a daily basis remotely. If you had a process, don't skip a process just because you're in a hurry thinking about other things. We have seen that. We've had it even happen in our own organization. No, just because we are in a different world working remotely doesn't mean that we don't need to follow the right procedures that we've always had in place. Communications is key because it's in a new world. I highly recommend some type of communication standard that outlines how you're going to respond to email, instant message, text, calls. How long is okay for a response via email? Most times with email, people expect a 24 to 48 hour turnaround. When you call somebody, leave a voicemail. I joke, I can call my wife, she'll see a missed call and return it back. But if you're calling a client, a coworker, so forth, we're in this triage mentality of, is it on fire? Your voicemail needs to say what it's in relation to make sure that people know why you're calling, that they need to return the call. Also, a lot of people will not answer a phone if they don't know the number. So what does your team do if they don't answer an instant message? We had this happen in our group. We had a client make a request that was a critical nature and timing. The night before, I forwarded an email. We had somebody assigned to it. The next morning, the request changed at 7:30. I emailed the service manager. Within 5 minutes, I hadn't heard from him, and it was critical to be done at 8. So I text. I didn't hear from him. I picked up the phone and I called. Now, he had already taken care of it, but I needed to confirm that. And in our scenario, with a critical nature like that, that was a good escalation of communication. Does your team need access to your phone system? Do they even use instant messaging? Teams and Slack are great for this, and those are options for communications, but you don't just throw a tool out there for people to use without giving them guidance. One of the things that we've done throughout this event is we have a daily check-in conference bridge. So at 8:15 every morning, everybody calls in, it's the main number, it's a pulse for the day. Do we have fires? What's being worked on? Does anybody need anything? And on average, that call lasts between 5 and 15 minutes max. Majority of those calls are 5 minutes and we're done. And then at the end of the day, we do a Teams video call. That's great because we get the human interaction. And that's something that is important, is people are going to be missing that face-to-face time. We're still all human. We've had somebody's kids run into the room, and my 2-year-old will throw a temper tantrum. Everybody's pretty understanding there, and it helps us all relate. Our weekly meetings are still happening. They're just happening via either Teams, Zoom, or WebEx. Something that I do recommend on that is, if you're used to an hour meeting, cut it to 45 minutes or 40 minutes. You don't have to be on a call for 30 minutes if you can do it in 5 or 10. So these quick little meetings have been very helpful for a lot of people to have a good pulse. I'll actually say that our team, I've been very surprised. I feel like we've been communicating better than we were before the stay-at-home order. And it's because we've had these tools in place, but now we're leveraging them. And I will say, moving forward, that as we come back off of this, people are going to realize they have the ability and can work from home, and more people may start asking to do so. Biggest piece of advice that I want to stress again to everybody is having a little patience. We've had a lot of volume, and employers and employees, both sides, need to have patience. We are dealing in a world sometimes that we've never seen and don't have all the answers to immediately. Stressing and security in the training is critical. We do have a couple of handouts. One of the handouts that I have is just a best practice of having people think about what they need to do when they're at home. We kind of walk through this with a lot of people. If they're taking a work computer home, take a picture of it before you leave, just to know how you need to set it up when you come back. And another couple of things that I tell as just tips and tricks: if you're doing critical work, consider now that peak times of internet usage is 7 a.m. to 7 p.m. An example was just 2 days ago. Was it 2 days ago? The banks, when the stimulus checks got sent out, their back-end systems were overrun. So you couldn't log into your banks. It's just because of the massive amount of transactions that were taking place. The Friday the applications opened, when the SBA first announced the EIDL, you couldn't even access their servers, and the internet slowed down because of just the amount of traffic going to it. If you have people working at home, simple things to consider is everything that's using your home internet matters. So if you're using Netflix or any other streaming service, be aware of it. Netflix has an option to change it from HD to standard definition. Not to say don't use it, but change that. There was a report about 3 weeks ago that said all internet traffic, about 52% was Netflix. And then one of the other pieces that sounds silly, but remove unnecessary devices from your home network if it's not critical. Not everybody has broadband, 300 meg download speeds at their homes. So if you've got 5 Alexa devices, a Google Wi-Fi, your kids' tablets, all your phones, you can have 20, 30 different devices at your house that can be on the internet at the same time you're trying to actually do work. I'm not saying to shut them all off, but if you're having issues with that, just be aware of it. With that, we'll open it up to any type of questions that anybody has. We will be having a follow-up email of the recording and having handouts that we will send out as well. And with that, I have to make sure everybody is allowed to talk. Does anybody have any feedback, questions as it relates to any healthcare, HR, or IT for their business working from home currently? Everybody is allowed to unmute themselves now too.
I'll just throw out 2 comments that didn't make it to that slide deck you saw. One is that there's been a 60% increase in telemedicine volume. Most of that having to do with physical medicine, but also with emotional medicine for mental health, et cetera. And most insurance companies have opened up their EAPs and their counseling lines for free visits online. So if the need should arise, that would be something to check out in your policy. The other thing is people are asking, well, what if I have an employee who simply just doesn't want to come to work because they're afraid to come to work? They're afraid of the workplace. They're afraid of encountering, people and encountering the disease and getting infected. According to the regulations, there's almost a specific clause that's not written, but there is not a deniability feature in the law in either the CARE Act or the Families First Act. So that if an employee just doesn't want to come in or just doesn't want to work, that does not make them eligible necessarily for benefits of either one. Just so you know, we've had that come up a couple times, and so you might be aware of that scenario.
Mark, do you have a question?
Yeah, I thought I think it was the Family First Act, if you couldn't come to work because of the quarantine, that you could use FMLA for that.
Not if you're working at home.
Right. But initially we weren't essential, and so our production people couldn't work.
Right. Yep. So they would be eligible.
Okay.
In my opinion.
Okay.
Something else just to make note from an IT side, a lot of companies are asking their employees if they have everything they need to be able to work from home. Ordering webcams, ordering new equipment like laptops shipping has been delayed quite a bit. We were placing an order yesterday for a client on a laptop, and it's not expected to ship until the last half of May.
Wow.
And I had another friend in a larger enterprise business that is last week, you couldn't get a webcam on order. So you've got to find different places. Now a lot more has opened up, but it was massive amount of people trying to get those work from home items available. Any other questions? I see there are a lot of business owners on the call, and we've had some great conversations. I'll even open it up now to, Mark asked about people's experience going through PPP. Is there any other questions that you have that we all need to discuss as a group? Or if there are no other questions, we will respect your time and finish the session. All right, doesn't look like there are any other questions. Jim, do you have any other comments before we end the session?
No, those are the big ones. Thank you.
Thank you, Jim, for presenting. Thank you all for joining today. And we hope you found this information useful for yourselves and for your businesses. We hope you all have a wonderful day and a great weekend.